welcome to today's video. Today I'm going to be explaining to you how I became a medical social worker and the jobs that I've worked beforehand. So after this video, I'll have a more in-depth of what my job responsibilities were, what that job looked like, kind of like my hours and things like that, the type of qualifications that I needed in order to get that job. And that will explain a lot more in detail how I got to the position where I am of being a hospital/medical social worker. Now, oftentimes you'll see me use the two interchangeably just because I do work in a hospital setting, but also I work in a clinic setting. And so I work at a hospital level and also at a clinic level. So I just call myself most of the time a medical social worker just because a lot of my work is done outside of the hospital, but I am still meeting the patient at a medical facility. So I hope that makes sense to you and clears things up if you're confused on what a medical social worker is, what a clinic social worker is, and also what a hospital social worker is. So hospital social workers typically work in a hospital setting, and medical social workers don't necessarily have to work in a hospital setting or even a medical building setting. They could work with an insurance company, they can be remote, they can be more like outpatient services and meet patients at their houses to provide additional services. So they're qualified or classified under that medical social worker category because they're not necessarily meeting or at a hospital, like they don't clock in at a hospital. So also a clinic social worker is those who work in more like a healthcare field, like a typical clinic where the community goes, or an OB clinic, or maybe a pediatric clinic. So it just depends on what job title that they actually have and what they would classify themselves as. But that's kind of how I break it down personally. So as working in a hospital setting for now a little over 2 years now has been very interesting. I got a medical social work job just because my specific clinic that I work at was hiring an additional social worker to work with their MAT clinic. So right now I work with a specialized clinic who helps pregnant women who are expecting and who are wanting to find additional support and resources, or more of a specialized clinic to focus on their SUD and also their pregnancy. So we focus on that. So because of my history, I had several years of substance use, MAT history, I was a good candidate for the job. And then my practicum for my master's and also my BSW, I spent in a residential and outpatient facility. And then also I worked with a clinic on a large scale. They have different locations all throughout the St. Louis area, and I was able to work with them on their MAT program, and also was able to kind of like pilot that with them, and also just continue to build that clinic with them. So I had a lot of experience working with different populations, different types of substance use, and different types of treatment programs. And I also had a very good understanding of medication assisted treatment, just because that is what my master's program focused on, was the MAT program. So that's what my specialization was for my practicum. So I had all of this experience working with women, working with families, and I also had experience working in like a clinic or hospital type medical fields. I also had medical field experience. So even though I am not necessarily several years into the field, and I had just recently graduated in May and I got hired on in September. So I had my interview, I think in August, early August or late July, but it was August that I had my interview, and then September I started working. And that was just so fast from graduation because my practicum actually ended in July. So I didn't really have a huge gap of time where I wasn't employed or wasn't in school at the same time. And so that's how I ended up getting this position, is because I had a lot of experience working with the specific population. I knew a lot. I had a lot of connections already in the field. I had a lot of knowledge and things that I could bring to the actual clinic setting and the hospital setting that would benefit the team. It wasn't going to be a lot of training or education that my coworkers or management would have to provide for me, just because I had already knew that information. And so I beat out two other candidates that were actually LCSWs and I don't have my license at this point in time. And it's because I knew all of this information. I had all these connections. I was actually working with another program that was specialized in this, that I was able to meet with, even with women and pregnant women throughout that. So I had a lot of history and knowledge of medical terms and what certain things meant and how certain things went about in the community and how doctors operated, working on a multidisciplinary team. And so that's how I ended up going into the hospital. I do suggest that if that's something that you are wanting to do, that you get experience. I mentioned once to someone that commented under my video that if you know this is a goal of yours, to try to work your way up there. I'm not saying that you shouldn't automatically apply and see if you can get the job or if you can learn more about it, but look at the job descriptions from different states or even in the city that you're in and see what the qualifications are, see what they're looking for, see what type of history or experience that you need to have prior to getting the job, and build your way up to that. I built my way up to that without even knowing. I never really wanted to work in a hospital, never really thought that that was something that was for me, but when the opportunity presented itself, I couldn't pass it up and they couldn't pass me up. So I definitely would say to slowly build yourself up, get to know your community, talk to doctors if you can, talk to other MSW students who are maybe doing their specialty in medical or hospital social work, and see if you can shadow someone for a day or a week or however long, and just see if that's something that you like. Get to know different programs. If you want to work in pediatrics, maybe you want to work in the NICU, that's something that I could possibly be interested in moving forward, is working in the NICU, get some experience working with younger children, and maybe doing some hotlines, getting some experience with that so that you feel comfortable doing that. Take some courses where you can learn about conflict resolution, or even seminars and conferences and things like that, so that you can add that to your resume and add that to your experience. And I think that that should be beneficial for you if that's something that you're looking forward to going into the medical field. So I'd say that if this is something that you want to have as a goal in 2 years, by the time that you graduate, maybe you graduate in 2 years, then to slowly build your way up doing hospital things or learning about the medical field and getting as much knowledge and skill sets that you can to build upon that, so that when the opportunity comes, if you're up against someone who has more years or maybe a license on you, that you won't be able to be someone that pass up and they can work with you without a license. You do not need to have a license to work in the hospital. I've had several coworkers who are not licensed and are in the process, like myself, of getting their license, and so you don't need to have that. And if that's something that is required at your specific hospital or your specific clinic, then I say that you ask them if they can work with you, if you can be under like a 90-day trial where you can get your test date, or you have a test date and you want to be able to start working. And so then most jobs will accommodate you on that. So just make sure that you advocate for yourself and speak up for yourself. So when you are going through interviews at a hospital, make sure that you're actually real to yourself, because working in a hospital is not an easy task. It's not something that is for the faint of heart. I would say that you just be honest with yourself, be honest with the person that you're interviewing. Make sure that you ask and inquire about the team, how people communicate, and use this opportunity during your interview to also interview the manager or the HR representative who is hiring for this position, and inquire about social workers and what they do and how they are incorporated into the team, and how the care is incorporated for social workers to assist with needs and meet and help assist the patients with any barriers that they might have. And so ask those questions as well. Is it a team setting? Do I have a social worker manager? Because you will find that a lot of hospitals don't actually have an LCSW or a social worker who's actually managing them, which is definitely something that is a challenge and can be frustrating at times, because a lot of people in the hospital obviously look at things from a medical standpoint, and as a social worker, you have a very unique way of approaching a patient and informing them about information, because we're taught to meet the patient where they are, to use words that they are able to understand and comprehend, and to kind of break things down a lot further, to provide a little bit more comfort to them, versus a hospital. Sometimes they can be very curt, very to the point, very straight and strict, and they don't understand that there's other things that contribute to how the person or the patient got to where they are. And that's something that we like to think about. And also, sometimes doctors and nurses struggle with patients refusing to take medications, refusing to start medications, refusing to track anything. And we have a little bit more grace when it comes to that. Like, if a patient refuses to do something, we're kind of like, okay, well, this is my suggestion, this is what I would suggest to you. But obviously patients have a right to decide for themselves if they're going to engage, if they're not going to engage, if they are going to participate in their treatment or do or take their medicine. That's their decision to make, and whether it's life-threatening or not, they still have a decision to make. And sometimes I think the medical field might get that confused. And so I think that you have to be a person who's willing to advocate for yourself and also advocate for your patient. Not need a whole bunch of experience or specialized experience like I did in order to get a specific job. So I say go for it, apply, get as much information as you can from other Indeed or other applications, so that you kind of have an understanding of what the general consensus or understanding is of what a hospital social worker does or medical social worker does. But that's how I became a medical hospital social worker. I had a lot of experience that actually just made me perfect for this specific job. Now that I'm actually in a hospital setting, I don't think that it'll be complicated or difficult for me to actually transition into another floor or unit. Like if I wanted to do just strictly pediatrics or maybe internal medicine or anything like that, then I think that I would have a great opportunity and chance to doing that, just because I'm already accustomed to the flow of the hospital, how things operate, working even on a larger multidisciplinary team, meeting services and things like that. And so I think that once you're in, you're kind of in, and that's something that I don't take for granted, is taking this job, even though sometimes I'm just like, it makes my eye twitch. However, guys, if you are looking into being a medical social worker and you have additional questions about my workflow or things like that, I have some videos that might be able to answer some of those questions that you have. So if you want to look at my videos, my social work videos, what I do in a day, my work from home, I have some Q&A portions in those videos that may be able to answer some of the questions that you have. If you don't want to go through those videos, that's totally fine, even though it would help me. You can leave your questions or comments down in the comments down below, and I will get back to you as soon as possible. I hope that you guys are doing well. I hope that you guys are happy. I hope that you guys are well. Thanks for watching. Bye.